Hello everybody, welcome to 414 Community Health. This is a brief tutorial. Let me get rid of my little blue dot on my glasses. This is a brief tutorial to tell you a little bit about Module 6 or 414 Community. And to do this, I'm going to switch over to the Moodle page. Hold on. There we go. In the Moodle, it's just like the rest of them. It consists of 8 total weeks. You're going to notice with this particular module, you only have 6 weeks of classes, and you will have 2 weeks built in to week 6.4 and 6.5 dedicated to doing an assignment, and we will talk about that in a moment. In your Moodle, I'm going to have you scroll down. You will have your course faculty member here, and that will have the credentials and name and work information for your course professor. And going down a little bit, you'll see your important first documents. Within the important first documents, I'm going to ask you to please open the online course syllabus and take a look at that. And when you're done with that, go into your weekly logistics chart and course calendar. This will give you information about all of the assignments that are going to be due during this particular class or course. As you can see here on week 6.1, you're going to have an orientation to the course, and you're going to be learning about the historical development of community health nursing, a public and global health overview, community and assessment, and you're going to have some information on the Newman's systems model, which consists of primary, secondary, and tertiary prevention. Also, at the end of this week, before you start your next class, week 6.2, you will have your DQ and journal assignments. Healthy People 2020, Cultural Diversity and Affordable Care Act in the Community, Communities at Risk, Case Management and Managed Care, Discharge Planning are all going to be discussed during week 6.2. You will also see during week 6.2 you have an assignment due called Communities at Risk Brochure. Your professor will give you more information on this. You're also going to have your target group assignment due this week, and your professor will talk to you more about that. And you'll have your DQ and journal assignments due before the start of week 6.3. 6.4 and 6.5 are set aside for your 3 community assignments. Now, one of these is called your Community Practice Experience, and this is something that I've been working with you already on. This is where you spend 16 hours in the community shadowing an RN that works outside of an acute hospital setting. This can be in home care, it can be in public health, school nursing, occupational nursing, parish nursing, clinic nursing, any kind of nursing where there's an RN present that is not involved in acute bedside nursing. I will arrange these with you, and this cannot be arranged by the student independently. The reason being is several places where we set you up for your 16 hours, we have to have a contract with that particular place. And in order to assure that we have this and that all of the I's are dotted and T's are crossed, I have to be involved for this. So I'll get you involved. I'll get you all set up for your 16 hours for your community practice experience. The ideal time to do these 2 days is during week 6.4 and 6.5, where you do not have any actual classes. Also during this time, you can spend 4 hours shadowing a discharge planner. This can be any discharge planner of your choice, and this is something that you may arrange. The discharge planner does not have to be an RN, as frequently in different facilities, the discharge planners are social workers. And the last 2 community experiences that you have are to visit 2 different community agencies. Now, this can be any community agency that services the community. It does not have to have a nurse involved with the actual place. Examples for these are WIC, Meals on Wheels, homeless shelters, the Red Cross, and so on. As I said, they can be any 2 community agencies that you choose. Now, during your visits with these agencies, There's a questionnaire that we have developed that you may choose to use. I have some questions in there that you might want to ask. You may not do these interviews on the phone. They have to be done in person, and you need to spend at least 20 minutes at each place. Otherwise, you're not going to be getting the full amount of information. Many students choose to pick up brochures at these places, and for our online classes, you can have these scanned so you can show them to your classmates. For these assignments also, you will be filling out a grid. There are no writing assignments due for this, but the grid is something that needs to be completed, and I'll show you that in a little bit. In week 6.6, you'll be learning about health education techniques, hospice nursing, parish nursing, environmental health care, and occupational care nursing. And during this time, you're going to choose an article and share it with your class, and this is any article at all that involves environmental issues. You'll also have your target group assignment due this week, and your DQ and journal assignments, which will be due before the start of the next week. On week 6.7, your actual target group healthcare presentation is due. Now, the target group healthcare presentation is something that's done, and it is done on a specific target group that needs healthcare teaching, or any kind of teaching regarding a community health need. You can choose any group you want along with your professor to make sure that this is not something that another group is not already doing. So please do not start your target group presentation work at any point until approved by your professor. Something else you'll be doing in week 6.7 is disaster preparedness in the community, where you'll talk about bioterrorism and other kind of natural disasters. And once again, you will have DQ and journal assignments due before the start of week 6.8. During 6.8, you will have PowerPoint presentations due for your 2 community agencies interviews that you did. And you will share the results of these agencies with your PowerPoints for your classmates to watch. Your clinical log is due for the 16 hours community practice experiences, your 4 hours with discharge planner, and your 2 different community agency resource agency visits. You'll also learn about the management of infectious disease in the community. And before the start of week 7.1, you will have your DQ and journal assignments due. And that is the logistics chart. Okay, getting out of that. Okay. Down here we have your important first documents. You'll also have a guide regarding your community at risk brochure with complete instructions on how to create, a grid for your CPE discharge planner and community agency interviews. And this is what's going to be turned in during week 8. In your grid, as we scroll down, CPE. Now when you do your CPE, you must have the name, credentials, and signature of the nurse that you are observing. The nurse has to be an RN, it cannot be an LPN. It can be an RN with bachelor's, master's, it could be an NP, it just cannot be an LPN. And scrolling down, your discharge planner will sign here along with his or her credentials. And once again, it does not have to be a nurse. And your community resource visit logs can go here. And this is where you will just put a brief indication of your activities. And that's the grid that is due during 6.8 that I talked about. You will also see grading rubrics for all of your assignments right here. So if you have an assignment, please look at your grading rubrics so you know exactly what's due for that assignment. Okay, so that is course 414, the community promoting wholeness. Thank you so much, and I hope you enjoy 414 community promoting wholeness. Take care and God bless.